have provided data on nursing and on hospital financing to the Belgian government, maybe also to other political actors, other governments, also other political institutions. And might we ask, in your experience, how can data provision effectively influence health governance? Like, whom do you need to reach with the data? What do you need to communicate? How do you need to communicate it?
Yeah, thank you very much for the interview, first of all. And to answer your question, I have been 40 years a nurse now, and already 40 years, data gathering, data collection is at the core of the nursing care process. If you cannot name it, nobody will take care of it. So data collection has been frontline data collection, using it when I was working at the Belgium level at that time, 20 years ago. The government picked up nursing minimum data set to finance the Belgium hospital system, but also the community care nurses have data collection through the ADL scale. So there is a lot of data collection from frontline that can then be aggregated and be used for financing systems, for informing the decision-making process. So policymakers, politicians, they don't read the book to make decisions. They need a half page, and that half page is a sentence or is a statistical factor analysis of do this now in this way and this way, and then they have the arguments, the evidence behind it to explain it. So data collection is extremely important.
So what do we need, in your opinion, to do to introduce e-health in kind of the right way, in the best way, increase the adoption of e-health care delivery by the health workforce in the most efficient way?
I think there are over 300,000 apps to use in the e-health services. So they are all developed without frontline people. So they are, in fact, a little bit sometimes imposed on us, and the industry is developing them ad hoc in one way or another. And in fact, it is wrong, because you only will have trusted solutions that are picked up at some stage if you develop the services, the e-health services, the apps with the frontline people, so that they see the benefit of it for the profession, for the patient, for the health outcomes. And this is currently lacking. So co-creation, co-design is the only way forward to have trustful e-health services solutions.
Policy on the healthcare workforce generally emphasizes the value of multidisciplinary teams for improving patient care, and in particular chronic care and care delivered in the community. However, expanding the use of multidisciplinary teams in all settings has faced challenges in terms of breaking down silos and working across professional boundaries. So how do you see the role of nurse evolving in the context of multidisciplinary teams in the future?
I think the development of the advanced practice nurse, the case manager, how we called it so many years ago. I mean, if I'm working in a unit as a nurse today, I mean, I have perhaps 15 different professionals who are coming to see the patient at some stage. And the nurse needs to manage all these different players in the healthcare sector. And so the nurse in an advanced practice role will have a key role, not only within the hospital, but more important, between the hospital and community care. And that is not well developed. So we need to invest in making a bridge between what happens in hospitals and universities and what happens in the community.
So would you say, from your perspective, from your experience, did we learn something from the Ebola pandemic that helped nurses cope with the COVID-19 pandemic? Are there any lessons that should have been drawn, but that weren't drawn from either of the two?
If you look at the 2015 Ebola report that we handed over during the Luxembourg presidency. And if you look at today's COVID-19 report, they both have the same title. We are not prepared unless we are all prepared. And the recommendations stay exactly the same. Look at the recommendations on stigmatization. I was surprised during the COVID-19, but it's the same for the Ebola period that we survived, that nurses were stigmatized so much. You know, you had nurses. I remember a nurse in Malta in the Mater Dei hospital working there who said, Paul, my family said to me, please don't come home during the COVID when you're working with COVID patients, because you don't have the equipment, you are not protecting yourself. Stay and sleep in a hotel until you are safe. Don't bring COVID-19 home. I know that nurses have been beaten up in community care because they drove from one house to another to give the insulin injection in the morning, doing the basic care. This has not changed. If it is Ebola or COVID-19, this has not changed. So our culture or attitude is stayed the same. So we should look at the EFN recommendations on protection and prevention of when these pandemics come across, and what we need to do with the frontline people to protect them and that they listen. So it is very important that governments listen to the frontline people.
First of all, if you could make 3 concrete changes to the situation of nurses, of the healthcare workforce in Europe in the blink of an eye, what would that be?
First of all, use the recovery and the resilience funds to support frontline nurses, and do it now. Not tomorrow, do it now. Secondly, focus on recruitment and retention. We need more nurses in the healthcare sector, in community care, in hospital care. And thirdly, develop advanced practice nurses in the EU.
If you could make 3 concrete changes to the governance of healthcare in Europe in the blink of an eye, what would that be?
The governance issues, especially through the European Commission, but also the member states, is to invest in the healthcare sector, to put health as a priority of the European Union. And that means change the treaty. Make health part of the solution, not of the problem.
Very nice.
And that needs to be done now, I think. It's time to do it.
That's a very strong statement. Thank you very much.
Yeah.